delight it is to meet you again. I'm so happy that you were able to participate in my conversation series. We have so many questions, and you're a world-renowned scholar on all things pertaining to social norms. And it's fascinating because it's one of the biggest kind of go-to places that people who are interested in behavior change, it's such a natural and intuitive and powerful way to not only understand the why of human behavior, but in fact have the opportunity to shape it, sometimes for better, sometimes for worse. So what a delight and what an incredible opportunity for me to learn more from the one and only Cristina. And so thank you so much. And I've got some questions that are already put together for you that hopefully will help us dive into some of the topics as it pertains to COVID-19. And it's so helpful, I think, for us to learn how you're thinking about these things and how you're applying your scholarship to these challenges. So without further ado, I'd love for us to start with understanding how you think social norm insights can play a crucial role in helping us fight the pandemic. And we've had some challenges with people complying with behaviors that would basically give us the solution, such as wearing a mask in public and engaging in physical distancing. So please share some of the perspectives that you've got.
Thank you, Kelly. This is really a great question. And I'm working on that, actually. I have done some research in 9 countries, so I can talk about that. But basically, the interesting thing is that we are facing a major social experiment. Unwillingly, but we're facing it. And what's happening? So we are in the middle of a social dilemma. What does it mean? It means that individual and collective interest may diverge. So people, have, as you say, to wear masks, to practice social distancing, lockdown in many places. And of course, this is costly personally, even from an economic viewpoint, but also psychologically it's costly. People would like, to go out, not to wear masks, it's uncomfortable. But of course, in the common interest, people have to do that, okay? So this is a perfect time for what we call norm nudging, okay? And why not nudging? Because typically the behavior I've just described are interdependent. What does it mean that behavior are interdependent? It means that our preference for adopting certain behaviors, wearing masks, keeping the distance, lockdown, etc., very much in many cases, and for most people, depend on what we expect other people to do, okay? And also very often on what we think other people think is appropriate to do or inappropriate to do. So there are, basically we have expectation, I call them empirical expectation, is descriptive, other people do, and normative, what other people approve or disapprove of. And our behavior when there is interdependence is conditional on this expectation. I choose to behave, to put the mask on or not, depending on what I observe or I think, I believe other people are doing, okay? If most people don't do it, maybe I have less of an incentive to do it myself, also because is a behavior which is not that pleasant, okay? So this is very important. In the interdependence of behavior, conditionality on what we expect others to do or approve of. But the interesting thing is norm nudging tries to change or induce these expectations. So what is nudging? The typical case of norm nudging is when you give people information about what many other people are doing and what's behind this information, this idea of sending this message. The idea is, oh, people will condition their behavior on this information. You know, to do norm nudging, you have to believe that the behavior is conditional, otherwise it's totally useless. And, you know, we know about norm nudging with use of electricity, for example, or with recycling. There has been a lot of norm nudging there, both empirical, normative, etc., etc. Now, the question with norm nudging is it may backfire. And why it may backfire? It may backfire because you send the wrong message, basically, or you send an ambiguous message, and I will come to that. But let's keep in mind that it has backfired very often with energy consumption. Some norm nudging work, some did not. And there are various reasons I will discuss. But so why is norm nudging important? Again, because if behavior, as we believe, is interdependent, you know, we can induce people to behave in a better way, in a pro-social way, by telling them what other people are doing or what is approved or disapproved of, okay? Now, we know one thing, that descriptive information, telling people what other people do, is more important than a normative message, okay? We know I've done a lot of research on that, we know that, but I can give you another reason. If you look at what people infer, okay, what they take in from an empirical message. So if I tell you, Kelly, you know, most people in your line of work, you know, do such and such thing. The usual inference that you will draw is they approve of that. Okay, if they do, they must approve of it. Okay. If instead I tell you, Kelly, most people in your line of work think that one should do this sort of thing. Typically, your inference will be, well, I'm not sure that all these people do that thing, okay? So if I give you a normative or injunctive message, it's not always the case that you infer that people really do that. You know, words are cheap. And so, you know, people say, yeah, we approve of that, etc., but then they may not do that. So the descriptive, the empirical message, telling people what other people do is very, very important. Also, it's very important that there is no conflict between the descriptive and active. If I tell you most people do that, but most people think it's okay not to do that, what do? You don't do it. Okay, so you will interpret these conflicting messages in a self-serving way. Again, because there are a lot of selfish incentives not to behave in a pro-social way, especially in this case. Okay. Now, it's what has been happening in the newspaper, on television, etc., is very worrisome. Because I remember watching television and seeing that a report that hundreds of people in Florida, especially young people, were on the beach, not wearing masks, not keeping the distance, etc., etc. So this is a very powerful descriptive message. It tells me, oh, a lot of people don't do what in theory should be done, okay? And what does it signal? What this message signal? Not only that people don't do the right thing, don't put on masks, don't distance, etc., but they disagree with the prescription, you know. And this may lead us to doubt the seriousness of the prescription. Maybe it's not that serious. You know, if people do these things, maybe, you know, they are right. And this is a temptation to make self-choices again. So this is very important. Norm nudging is important. Norm nudging can be crucial, but norm nudging can backfire because it depends on the message we send, whether the messages are conflicting or not, and so on and so forth. So your question is about, my research around norms and COVID. And indeed, I did quite a big research on 9 different countries, okay? And a variety of countries. I had the US, I had Mexico and Colombia in Latin America, where there are lots of problems. I have South Korea and China. And in Europe, I had 4 countries, Italy, Spain, the UK, and Germany. And I was looking, at different component, but I was looking at people expectation and behavior before the lockdown and after the lockdown. And I also was giving people vignettes. And what we do with is really important because a vignette gives people an hypothetical situation. And the subject in this situation, the character in the vignette, is not you. So you don't feel bad responding one way or another. It's a fictitious character. And this fictitious character may be in one of 4 different situations. And we give one situation to each group of people, different situations. And one situation is, this person lives in a place very similar to the one where you live. And in that place, most people comply with the prescriptions, and also most people approve of complying. What do you think this guy will do? The other case, the opposite, is very few people comply and very few people, think one should comply. What do you think the guy will do? And then we have intermediate cases. Most people comply, but most people don't think it's so important to comply, or most people think it's very important to comply, but most people don't comply. And so we look at how people respond to this hypothetical situation. And the way they respond tell us if their expectations are if their behavior is conditional on their expectations, basically. Is a technique I use in India to look at open defecation or child marriage, etc., but is very useful here. And I am finishing an article about the result. But I want to give you the most interesting result here. Of course, people with high empirical, high normative expectation comply. Yeah, very high. However, there is a mediator of compliance, and is trust in science. Okay, we measure all sorts of trust using the World Values Survey that measure all types of trust. And what we notice is that the highest possible trust is always, on average, in science, not so much in government, okay? And not so much on other institutions. But the interesting thing is, when you have high normative, high empirical expectation, trust in science leads you to comply almost 100%. Okay? If you have very low expectations, trust in science does not matter. So trust in science is a big enhancer of positive expectations. Trust in government is okay, but not as big. Trust in science is huge, is absolutely huge, is amazing. And you see that in every country, even those countries like Mexico, where trust in government is very low. But if for those who have high expectation, trust in science bring them up. For those with low expectation, trust in government may help a little bit, trust in science, zero help, zero. So it's very interesting to look at that. Okay, and of course there are demographic differences, but the demographic differences are more related to young versus old. Young are very optimistic. They don't believe that they will get sick. Old people have much stronger belief, obviously. Women are more compliant than men. And this is to be expected. We know, that women are generally more compliant to social norms, etc. But the interesting thing that I notice, and is the core of the article I'm writing, is trust in science is a crucial mediator, between high expectation and total compliance. So if you don't trust science, you may have high expectation, but you don't do as well. Is very interesting. It tells me something else. The US, the conflict between government and science. So we have had a lot of moments of tension between what the scientists say, what the experts say, and what the government says. And this is terrible. And I'm not saying because it's the US versus is terrible, evidence-based, because my research shows that trust in science should not be diminished. That as soon as you diminish trust in science, sending conflicting messages, the government says, well, scientists say that, but this is very damaging. It's the most damaging thing you could do. Okay, so it's very, very important. Trust in science is the most important thing. And you see that in all 9. Okay, and so my conclusion is, please don't diminish trust in science. Do not do that. Okay, this is very, very important. And government may vary. There are places like China, they declare a lot of trust in government, other places like much less, etc. But trust in science for those that have high expectation is crucial, bringing you to the top.
That's fascinating. I'm American, but live in Canada, in particular the province of Ontario. And we have a political leader here by the name of Doug Ford. And when he first won the election, many people complained that he was sort of the Donald Trump of the North. And he's on the centrist or right end of the political spectrum in terms of fiscal conservatism. And yet the two couldn't be more different on many, many dimensions. One of them is the way that the premier here talks about science and has made many references to sort of what the scientists say. And that has, I believe, if what we're seeing here is consistent with your research as well, has been very helpful in keeping our cases at the level the level we're dealing with, which is we're not at zero yet, but we're getting very close. And we have some setbacks, but overall we are getting our R naught value below 1.
Excellent.
Yes. And that said, a friend of mine who used to be the chief marketing officer for BEworks asked a very difficult question. She's had a career change. She's gone into the travel industry. Last year.
Bad timing.
Last year, she bought a company dedicated to women who love to adventure and travel around the world, which is fun. It's a really neat thing, and it fits her incredibly well. And now she's struggling with these massive questions about how do we help travelers feel safe is it possible, first of all, to be safe? And the science says it's possible to be safe with all of these conditions being met, as best we know. But one of the challenges that she's finding extraordinarily difficult to help respond to and help contribute to is her clients in the airline industry have passengers who at some point in the flight remove their mask. So they pass through what they need to pass through, and they're taking off their masks in flight. The only solution historically to non-compliance to the orders, shoves, budges, if we use the technical terms, for BE, has been, threat to, you could be arrested, escorted off the plane if you're still on the runway, or what they're doing now, turning the plane around. And she was wondering, and this has happened a few times, planes being turned around for that kind of non-compliance. And so I was so excited. I was wondering what your point of view was on, is there something else that can be done to help discourage this kind of behavior?
Well, I heard, I was talking to a friend the other day who was telling me about what happened with an American Airlines flight, actually, where this person was keeping the mask here under the nose. Because a lot of people wear the mask under the nose, which is completely stupid, like this, the mouth. And basically, this person was told 4 times, and each time she put the mask up and then put it down again. And basically, she was escorted out of the airplane, okay? And then I was asking this friend exactly what you were telling me. So either the person is escorted out of the plane or a report is filed. So suppose you are in the middle of a flight and somebody takes off the mask. Is a serious medical reason. They should have documents to prove that. But then, if the person doesn't want to take to put up the mask again, you have to write a report. And the consequences are very serious, because the company may ban this person from traveling on the company. I don't know for how long, but there is a ban. So I think that this is necessary. It's always better to convince than to punish. This is my line always, you want to convince people. But some people, for some reason, may not be convinced. And or you have to use harder means. So, for example, I give you another example of Italy. In Italy, we had, when there was a lockdown, it was very serious, tons of people were dying, we had police cars in the street. And if you're going walking or with a car or with a bicycle, they will stop you. And you need to show a document. You download it from the internet, and you declare why you're out, what you're doing. I'm going to the supermarket to buy food, okay. Or I am going to visit my mother who's sick, okay. But you cannot go visit friends or doing things that are not urgent, immediate, and important. And the police gave incredible fines because people were not complaining at the beginning. So the interesting thing is sometimes either because they are not convinced about the message, or because the messages, necessarily I must say, because we didn't know anything clearly at the beginning of the pandemic. There are all these people sick, dying, and every day you learn something new. So there was a lot of uncertainty and ambiguity in the messages. And when there is uncertainty and ambiguity, unfortunately, people may not follow through, okay? And so because of the situation, people were trying, to escape basically the rules. And so there was need for very, very serious containment. That then, then things went on much better. what's happening now is there are new waves in Europe. I don't know if you know that. And the new waves are young people. And again, young people that are told that basically that the information, the typical information is only old people die. Old people, you know, who are in old people homes, in hospital, etc., then they die because they get sick, etc. They have diabetes, pre-existing condition, but you know, young people, they don't say it should be okay, but the inference was that. And again, when I say pay attention to demographics, I meant exactly that. You have to send appropriate messages to young people. Because if you only send a message about old people are the most vulnerable, is wrong. Because young people are vulnerable too. And so you have really, when you think of nudging, I'm going back to that again, you have really to pay attention to the age group, the demographic, etc. Very important, very, very important. The work that was done with young people, I think, was not that good. And that's why, you know, they started like in Florida, in Barcelona, you see the beaches were full of people without masks, etc., because they thought, oh, we are safer now. No, we are not safe until there is a vaccine, basically. And so the message, again, should not be ambiguous, should be rightly directed to that particular reference group, we call that reference group, and should be clear and not sending conflicting information, basically.
One of the challenges that I saw early on was the complexities that we have in enforcement officers, be they police or other bylaw enforcement officers,
Yes.
Doing things that didn't seem to make sense. So for instance, there was a case that happened in Montreal where it was a woman's birthday and she stood at her front door and her friends arranged for a surprise birthday by driving by in their cars. Yeah. They drove their car towards the house, which was set at a distance from the road. Each, you know, leaned out the window, sang her happy birthday and drove on. And the police ended up giving the birthday girl, I think it was $1,000 fine.
But apparently, well, she can contest that because apparently she was within the limits that were set by the government.
Yes.
Okay, and so if you are within the limits, there is basically no problem. Yeah. If you keep the distance, maybe you have a mask, etc., etc. So I think the police was wrong.
They were wrong. Case. And unfortunately, this creates a reactance and a difficulty in following these guidelines. And as we think about, you know, our counsel as scientists being shared with public policy leaders, we need to ensure that the training that goes to them, the messaging that goes to them is the media will be looking for these cases, people will be looking for these cases as a way to kind of create perhaps unnecessary tension. And the, you know, the sound policy needs to be executed by enforcement officers that have a better grasp of what the point of it all is, because the impact of that can be a massive setback. I'd love to hear your thoughts on that.
I agree with you. You know, there is a certain in certain prescriptions. Okay, there is a logic to prescribing a certain distance because given what we know about transmission, we think that mask plus distance may help, etc. Now, it is, and you're very important, not just in this case, but in general. You know, the big issue here is you cannot be too specific okay? You cannot be super specific and say, okay, and this actually happened in Italy. I give you the example. And the example was, you may go out only for necessary thing to do. What is a necessary thing to do? Okay, so it was very general, non-specific, and then of course, people were thinking, okay, taking out my dog is necessary. You know, maybe visiting a friend who's depressed is necessary. Maybe doing this and that is necessary. So there is always a tension between a general prescription, okay, like, you know, you should stay home unless, but you have to say unless because people have to go and buy food, etc. And, you know, being super specific and maybe leaving out things that people, you know, think are important. Like, I'm going to the doctor, you know, is it necessary, is not, etc. And I know there was a lot of confusion about that. And I think this is sort of a necessary problem that we have. When we give a general, okay, injunction not to do, you know, or to do certain things, the general injunction cannot be very specific. You know, you cannot say, okay, 1 meter and 5 centimeters, or, you know, 95 centimeters, etc. I mean, obviously, people, you know, will try to manipulate this information. So what they did in Italy, they tried to make it simple by saying, okay, you have a form and you can go to the doctor, the supermarket, and maybe to visit your sick old parent, provided the parent doesn't have coronavirus, etc. But again, there too, there was some room for manipulation. So it is, I think you're quoting, your case is very interesting, is universal. When you have a prescription to do or not to do something, it cannot be that specific because then, you know, you will have the police doing crazy things. Exactly. But, you know, maybe the police should be trained to say, okay, if the person has a mask and there is a distance, then, you know, is not a criminal activity, etc. So, you know, there is a way to balance these things. But when you send a message to people, pay attention, because the more generic the message is, the more room there is for interpretation.
So, speaking of room for interpretation around a new behavior, we're working with an organization that has launched a notification app. Some call them tracing apps, but in the same way that we've all recognized that social distancing is not the right term, it's physical distancing, we're calling this a notification app versus a tracing app, just because of the connotations that go with those terms that cause us to react in ways that are misguided from the intentions that you're speaking about, or the principles that are underlying this new practice. So how can we create a new norm around these notification, or sometimes known as tracing, apps, and having that be something that we keep on our phones, that we're comfortable with, and in fact that we even encourage others to download onto the phones and keep running, even though they use the battery, and they require the Bluetooth, and have people actively or somewhat passively, but you still have to be actively engaged enough to get this thing up and running. Love to know, how do we create this norm in downloading it, norm in supporting it and keeping it running, even if ultimately maybe it can be passive?
This is a great question because I follow very closely Italy and the US also. And you're absolutely right. Language is everything. Because the moment you say tracing, people feel, oh, you are controlling me. I don't want to be controlled. I want my privacy. Okay, God knows what you do with this information, etc., etc. So this is very important. But it's also important that for people to be told and reminded that as they have rights, they have obligations. That my right ends where your right begins. Okay, my freedom ends when your freedom begins. And I have an obligation to respect your freedom and your health, your right to be healthy, as you have an obligation to respect mine. And I think there has been, with this tracing story, etc., in Italy there was a very bad reaction to the idea of tracing because it was, the language was just tracing. And so people said, no, 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 my God, what are you doing to me? And so they were not putting this application on their phone. It was really quite a big flop. And the issue is, and this is another interesting point that I made at the beginning, but I want to make it again, about, you know, how do you create a norm in which people start using the application, etc. Now, we are in a situation where people know that most people are not using it, okay? So you cannot lie to people and say, oh, you know, 80% of the population is using it, because people look around, they know their friends, nobody's using it, so say, what are you telling me? It's not credible. But what we do when the descriptive expectation, the empirical expectation are very low, one way to obviate it is try to find situations where people are doing very well, in this case, with this application, okay? So it is not the whole population, it is not even the majority, but there is a minority that uses it and is doing well. And so you have to focus on that, on a minority who's doing well. And I'm sure there are people that, you know, are going to use it. And what does it mean they are doing well? Well, they are not only protecting other people, but protecting themselves. Okay, and so basically when I give information about a compliant minority, because the majority is not compliant, I always try to make people realize that it is in their interest to comply, that there is a reward for compliance, that is not just a moral action, but it is an action that is in their interest in the end, okay? So, you know, sure, you have a right, you have obligation, other people have obligation towards you. So I would use maybe the obligation idea, okay? And, but also focus centered on small group of people that are using the app and it's helping them. So I would focus on that because people know you cannot tell people a lie.
Yeah.
Especially in this thing, they know their friends don't have it, etc. But there must be people who do use it. There are usually people who use it. In Italy, a certain minority uses it. Focus on that. And what are the benefits? And maybe interview some of these people and let them say what's good about that.
Yeah, this is an approach of it takes a series of interventions where if we start by perhaps making a larger investment, finding that smaller group that we can then in turn show that they are our early adapters. And in this case, it would be great if they were millennials, for instance, if we talk about that in this case where demographics would be useful. Yes. Because that's a targeted population that is one of the ones that all of the prior information says that you use, and they aren't at the higher risk personally from a health perspective, but there is still a risk there. but they are at risk of being a carrier and perpetuating this virus being endemic in our society. So if we were able to take your approach, your recommendation, find this minority and spend our first round of time and money cultivating this minority, then they would help us unleash what we need to now leverage this establishment of a norm that is benchmarked off of this group. So that makes a lot of sense, and that seems something we would be able to execute this psychology and marketing in a staged way.
I agree with you. This is the demographics that needs to be approached, because now all the new cases come from younger people, okay? And older people know they have to protect themselves, you know, that they stay at home, they wear masks. I don't think older people have any problem at this point. They learn their lesson, but younger people don't. And so having a sort of trendsetter group of younger people who can spread, okay, the use of the app and make the app palatable to them. Make it palatable to younger people, thinking, you know, what it is that younger people do on TikTok or, you know, other websites that they use. So I would have a marketer, basically, you know, do a campaign on that with a language that is really geared to the younger generation. And then I think it would work. I think it would work. Because also there is a lot of imitation. There is much more imitation in younger people than in older people. You know that from psychology. You know, they tend to imitate a lot. And if you think of lots of new fashion, etc., they usually start there. So this is a population that I agree with you, Kelly, should be targeted.
And epidemiologists have told us that this notification is crucial in the fight against this pandemic. So we've got to try these ideas out. So I'm so grateful that you shared them with us, and I'm very eager to build on the research that you've established for us. It's crucial that policymakers look to the research that you and your colleagues and your team have been putting together to help advance our, you know, our strategies and tactics in the war against COVID-19. So thank you so much for your time today. I'm very grateful to have heard from you, and I've been able to spend time with you during COVID-19. It's not just theory.
I know. Thank you so much